Welcome to Movement Project. Extension exercises like these are some of the most prescribed in physical therapy for herniated discs. But what if it's not helping? Stay tuned and I'll show you multiple modifications to see if it can help you get over the hump.
A study in 2016 by Mazzoni et al. Found that subjects with low back pain had significantly less lumbar extension motion. We use extension to treat the herniated discs because it has to withstand so many forces like compression and rotation, but most of all, the excessive forward bending that we put it through every day. Your disc is like a jelly donut. If you keep pressing on one side of the donut, it's only a matter of time before the jelly comes out the other side. Fortunately, our discs are made with a tough ring of tissue that keeps the jelly contained. When it does herniate, it goes off to one side, which is why the straight extension often misses the mark and can seem like a waste of time.
If we zoom in on Tiny Tim here, we can see that the curve of the back should be forward. So when you're repeatedly bending this part of the spine, it's causing these discs to force themselves backwards. Now remember, anytime we're doing extension exercises for pain that's radiating into your leg, your goal is always to have the symptoms move out of your leg into your back. If the opposite's happening, you need to stop immediately and contact your physician or movement specialist. One thing to consider with the standard press up is your hand position. If I place my hands closer to my hips, it's going to put in more of a traction force, separating my vertebrae more than if I move my hands up toward the shoulders. When I move my hands up here, that force is more posterior or backwards, shifting the discs and back segments into more extension. One might help you more than the other, so it's just something you can experiment with. This is one variation we'll use to try to increase the lumbar extension pressure. We take a deep breath on our way up. Once we get to the top, let all the air out. It's going to give you an additional stretch through the low back.
Now these are what we would call overpressure exercises for extension. They're not really biasing one side or the other. They're just helping you get extra extension beyond what you can get with the standard press up. This is another way we get more focused extension stretch into the spine. We flex both of our knees up fully. This tightens up our quads and locks our pelvis into place, so there's less hip help with the motion, isolating it more in your lumbar spine, giving you more stretch. You won't feel like you can go as far, but don't be alarmed. You can experiment with these exercises, but ultimately you just want to settle on one that gives you the most relief. This variation is going to allow you to get specific stretching and extension at a vertebrae level. So here I'm using a resisted TheraBand. You could use a rolled up bed sheet just the same, and I'm locking in the segment where I want the stretching to happen. You'll experiment, move it up, move it down, find the spot where you get the most stretch. Now in my case, I move pretty well in the lumbar spine already, but not so well in the thoracic spine. So what I would do is just take that band and move it up to a higher segment, lock it in, and now I'm getting more isolated stretch where I can benefit from it. Feel free to experiment and find the spot that gives you the most relief. Now we can move on to one-sided or unilateral stretching. Here we have our left leg hanging off the table and the right leg on the table. This is going to allow us to isolate and stretch that right side into extension without bringing the left side into extension. Sometimes we'll have the injured side hanging off the table because there's just too much joint irritability, and this allows us to bring it into some gentle extension without having that hip back. Now I can move that foot that's on the floor forward or backward to find the position that gives me the most relief. And then from there I'll just go through my repetitions. Sometimes people get more relief with the injured side off the table, and sometimes people get more relief with the injured side on the table. You'll just have to experiment and remember that the goal is your symptoms or pain should always move out of your leg, up into your back, and you should have no pain that wasn't there before you started the exercise. This is another therapy trick we use to bias one side of the spine by locking the other leg into rotation. So you're going to bring your leg into a figure 4 position, locking it behind your knee and calf area. Then you're going to go through that standard press up motion and you'll feel increased stretch in the lower back opposite the leg that you have crossed figure 4. Same deal as the last exercise. Try right and try left, see which gives you the most relief, and stick with that until eventually you can knock it out on both sides without any symptoms. Just like the prior group of exercises, experiment and find which one of these exercises works best for you, and then stick with that as part of your regular routine until you have full range of motion and you're pain-free.
Now, all these exercises are great and can usually help your pain, but unless we address the reason why your spine's flexing too much in the first place, it's just going to keep recurring. So we need to look at things like your posture. We need to look at things like the strength of your back extensors that are able to hold your spine in that position and keep it from breaking down. And of course, we always want to look at your ability to hip hinge so that your spine isn't flexing too much with daily activities. If you want to see other videos related to low back pain, click over here. If you want to help me cut out unnecessary surgeries, subscribe to the channel and click over here. Remember, if you want to feel, perform, and live your best, you've got to move your best. Keep it moving.